So can you see it at the moment? Yeah, brilliant. And you can all hear me, I'm assuming. Okay, brilliant. Okay, so good morning and welcome to the research seminar based on the adult social care response to disabled people subjected to domestic abuse. So before proceeding, I just want to give a health warning, really, because we know that domestic abuse can impact anyone. So if you find anything triggering, please just look after yourself. And I will pre-warn you if there are any trigger warnings. There will be a clip regarding a case of domestic abuse. So I'll pre-warn you in regards to that. Just essentially look after yourself, really. So just to let you know the outline of the seminar. So initially, we're going to talk about myself very briefly and the relevance of domestic violence and abuse to social work and also adult social care specifically, definitions, motivation, literature, research findings and peer discussion. But really, to break it down, the first part will just centre obviously the disabled victims subjected to domestic abuse, and the second part will really just focus on the research itself. So just to give you a brief background about myself, so my name is Sandra Simpson. I'm a social worker based in the adult social care and in all age disability service in Coventry. I've worked there for 4 years. I'm also a research champion for West Midland ADAS. I'm in year 3 of my professional doctorate, and I'm also a qualified independent domestic violence advocate. I was qualified like many years ago, and I retrained last year, I believe. So we're now going to go into the relevance of domestic abuse and the link between adult social care and social work. So in an attempt to tackle domestic violence and abuse, the UK government introduced the Domestic Violence Act in 2021. The Act provided a statutory definition of domestic abuse and established a domestic abuse commissioner. The Act also introduces the term connected person, and the Act also recognises children as victims of domestic violence and abuse. Significantly, Part 4 of the Act places duty on the local authority to provide support and refuge to domestic abuse victims, including children. Under this provision, domestic violence and abuse survivors are supposed to be prioritised under social housing. And I'd like to ask the question to yourselves, really. Do you know how many refuges in the local authority, in your specific local authority, that can accommodate people who use wheelchairs or with physical impairments or with learning disabilities? I'm just going to drop in some nuggets, really, in terms of questions that we as practitioners need to go back and start looking in for ourselves. So obviously, the Care Act is of relevance, and Part 1 of the Care Act places duty on the local authority to promote the individual's well-being. That includes the protection from abuse and neglect. And of course, we've got the Section 42 inquiry. This is of relevance as it speaks to the safeguarding duties of the local authority have. And we also have the Mental Capacity Act. So as social workers, we're regularly undertaking mental capacity assessments, but under Section 44 of the Act, ill treatment and willful neglect of a person who lacks capacity is a criminal offence. As a profession, we're concerned with promoting human rights and social justice principles, and we know that domestic violence contravenes such rights. So let's get to the crux of my motivation as to why I wanted to look into disabled people subjected to domestic abuse. So I'm obviously passionate about supporting survivors of domestic abuse. Also learning that the data shows that adult social care have the lowest referral rates to MARAC. And MARAC is a multi-agency conference that supports high-risk victims of domestic abuse. Coventry City Council completed its domestic abuse needs assessment in 2021. Key findings identified that a 69% increase in referrals to the multi-agency risk assessment conference over the past 5 years. Of significance, though, the assessment identified that MARAC referral rates for disabled people subjected to domestic violence increased from 0% for the 12 months to June 2017 to 4% for the 12 months in June 2021. I was curious as to why there were such low rates to low referral rates to MARACs in general with adult social care. So yeah, that was really the impetus for why I want to look into this. This now leads me on to the prevalence, which we should always approach with caution for several reasons. Primarily because the experience of disabled victims of domestic abuse are often shaped by the narratives of non-disabled people. And we often see this within the risk assessment forms, such as the DASH. It's not really catered for disabled people. And also, the domestic abuse specific for disabled people includes impairment specific abuse, and it's not really acknowledged in the DASH form, and it's also absent from statistics. And we also know that particularly with domestic violence and abuse, it's underreported. And the society, we've still got to go a long way of finding accessible ways to report domestic abuse. And also, which is important, is that not all disabled people consider themselves disabled. So overall, UK research suggests that disabled people are subjected to various forms of violence in general at an increased rates across their life course, in contrast with non-disabled people. Within the context of domestic violence and abuse, the official national statistics figures indicate that disabled women are more than twice as likely to be subjected to domestic violence and abuse, in contrast with non-disabled women. The same data highlights that disabled men also face a disparity, since they were more than twice as likely to be subjected to DVA, in contrast with non-disabled men and non-disabled women. So it's also important to mention that domestic violence and abuse within the context of older people, because there is an intersection between age and disability for obvious reasons. As you can see, the proportion of domestic violence homicide victims were aged 70 and over. So if you work with older people in your team as a social worker, how many times are you detecting domestic violence? And do you consider this in your work as a possibility? So, of course, behind data is real people. And, it's really important today that we do center and focus on the people it impacts, which is disabled people. So I'm going to show you a short clip of someone that was subjected to that. Just bear with me. Hopefully technology will work itself out. Have a look. So this is a 5-minute clip. Let's have a look. It will hopefully. Oh, there it is. Apologies. Okay, you might not hear it straight away, so just bear with me while I change the settings. Okay. So like I said, it's 5 minutes.
Who truly care for him. He's almost unrecognisable from the man who, in 2020, was rescued from the squalor of his home in Chichester. With impaired vision and unable to move for himself, he'd spent 4 years confined to a single room with the blinds drawn, neglected and wasting away.
I wanted to literally go to sleep and not wake up just so that it would finish. Because at the time I didn't see a way out. I was just literally surviving week by week, day by day.
By the time these photos were taken during his eventual rescue, Tom weighed less than 7 stone. His teeth hadn't been cleaned for a year. He was filthy and disorientated.
At the time, if I hadn't had my iPad, I wouldn't have even known what month it was. I did anything to keep myself mentally stimulated because I thought, I'm well aware that I'm dropping down physically, but I will make damn sure that I will not drop down mentally. So I was constantly trying to do stuff to just keep myself going, really.
Shockingly, the people responsible were his wife of 10 years, Sarah, and his paid carer, George Webb, who'd moved into the house in 2016. Last week, in the first case of its kind, they were convicted in Portsmouth of enslaving Tom, cutting him off from his family and using his money to fund their lifestyle, which included their own sexual relationship.
To drain me, to actually not just financially, but just to break me down to nothing. The fact that between them, they were being so blatant while I was in the environment is just stunning.
But even he had no idea of the extent of their betrayal until text messages between the pair were produced as evidence. There was this from Webb to Sarah: "Get rid of him. Go find yourself a man. I think you need to leave Tom and get your life back." And from Sarah: "Remember, we are just using him. He gets paid soon, so I will take money out of his account for weed."
On a human decency level, there should be some sort of consequences, emotionally, mentally, for them to be like, I did this to another human being.
It hadn't always been that way. Tom and Sarah married in 2010, but Tom says any happy memories are clouded by what came next. He comes from a loving and high-achieving family. His mother Helen was awarded an MBE for charity work. His twin sister Kate is a successful actress.
People out there will be thinking, where on earth was the family while all of this was going on? Believe us, we were trying very hard.
They raised concerns as Tom withdrew from the family, but as happens so often in coercive situations, the defendants were very plausible.
They would smarten him up and have a haircut, shower, so on. So we began to think that things were okay. And when you asked Tom, he'd say, yes, I'm fine, I'm fine, I'm fine. But Sarah was always there, making sure that she was in control of the situation.
You've got family outside, social services, police, people you could call. Why didn't you just leave?
Because I was constantly under threat and duress. All my communications were monitored. Every phone call that I made, my wife said, you cannot make a phone call unless I am in the room with you.
Tom was effectively trapped, reliant on his abuser for care and coerced into silence. Only at the family's insistence did the police finally move in an operation compared to extracting a hostage.
Even if he could have got out of bed and got into his chair, he couldn't have moved around the flat at all. It was cluttered. There was items everywhere. So what you could see that he didn't move from that bed. Even at the end on the stand, George said that he thought he'd been a good carer, and Sarah believed that Tom had had everything he ever wanted and asked for. So no, I don't think that they really accepted what was happening.
Now, finally able to use his voice, Tom wants to help others suffering in silence.
I've survived it, I've made it through, but the reason I'm doing this is because I was very lucky. Not everybody has the support network that I had to get them out. You have to trust that somebody who's going to have your back to a certain level, who works within the system, because otherwise you might have a situation that I had where you get closed off from everybody and the people outside the system can't get in.
He and his family believe more stringent checks should be made on carers, with unannounced spot checks and greater powers of intervention. He's visiting the House of Lords this week to advocate for change.
If I can do something that makes the world better, that makes me feel better, because I feel like I've achieved something, like I've done something, so that people are safer who need to be kept safe.
His tormentors remain in custody awaiting sentence in July. He, meanwhile, is embracing his freedom. Rachel Hepworth, ITV News.
Okay, so yeah, I think there's plenty to be said there. I'll put back on the PowerPoint again soon, but there are some things that I would like you to kind of reflect on. The rule of optimism, and whether we consider it in the context of adult social care enough. And also just, you know, reflect on how you think about it personally and how we are detecting it, domestic abuse. And what I noticed was how it's constructed. You don't hear the term domestic violence and abuse mentioned much within that clip, and you also don't naturally mention it. I'll show you an article, actually. I'll put a link up, and from the BBC website, you don't hear the words and phrases domestic violence and abuse, and we need to consider why that is. Why is the language different? So yeah, so those are just some points. Let me go back to the PowerPoint. Okay, I think I'm on the right page. Not yet. So now going to continue to focus now on the literature review. So the purpose of the literature review I conducted was to understand the experience of disabled people subjected to domestic abuse by disability type. So I focused on 3 areas of disability. So developmental disability, which is also called learning disability or intellectual disability; sensory impairment, where I looked at deaf and impaired victims of domestic abuse; and neurocognitive disorder, where I focused on dementia. I hope to do further reading in the future around episodic disabilities such as lupus and MS. So research has indicated that people with a learning disability are at increased risk of sexual abuse. Pesca and Wendt conducted 4 in-depth narrative interviews with learning disabled women. Their study highlighted that stigmatisation and invisibilisation are factors as to why learning disabled people remain in a relationship. They state, society devaluation, the want for social status, and the need to have a partner are all significant factors that influence the women's experiences to remain in numerous violent relationships over their lifespan. It's widely accepted that having a learning disability is a risk factor in forced marriage, to the extent that the UK government has issued guidance on learning disability and forced marriage. So the motivation behind a forced marriage for people with a learning disability differs for non-disabled people. For instance, Claus and Fison 2021 research identified that the perpetrator's motivation behind a forced marriage can include securing care for the future and the belief that marriage will actually cure the learning disability. So studies examining deaf people subjected to domestic violence and abuse report that they experience the abuse in diverse forms, including psychological, physical, and sexual abuse. Deaf people are likely to be subjected to domestic and sexual violence at an increased rate, in contrast with hearing people. While the typology of abuse that deaf victims are subjected to is not dissimilar to hearing or non-disabled victims of domestic violence and abuse, research reveals they encounter disability-specific abuse, such as communication abuse, which includes removing the victim's communication device, such as a mobile phone, to prevent the video calls, purposely removing the hearing aid from the victim to force them to lip read, not repeating information, so information is missed. And there's also hearing privilege that can sometimes be used to wield power and control over the deaf victim. For example, the perpetrator can use the hearing privilege to exclude the victim from important conversations. They can also use it to manipulate professionals, especially when reporting the domestic violence to the police. They may do counter allegations and ensure they can get there first, because it's not as accessible for deaf people to contact the police. So literature concerning the relationship between dementia and domestic violence and abuse is often framed in the context of older adults, and terms used to describe the abuse may include abuse of older people or elder abuse, primarily because the likelihood of dementia increases with age. As such, the two intersect with each other. So earlier work looking into the relationship between dementia and elder abuse highlighted that there was a strong association between elder abuse and dementia. In particular, Sadler et al. 1993 found that where carers had mental health or alcohol misuse issues, there was a substantial risk of abuse occurring. Benbell et al. 2018 analysed 35 domestic homicide reviews in England involving adults over 60 years old. Of the 35 cases, dementia was featured in 6 of the homicide cases. In 4 homicides, the person with dementia was the victim, and in 2 of the homicides, the perpetrator had a diagnosis of dementia. Myths and stereotypes about people with dementia are featured as key findings in their research. For instance, one myth suggested that older people do not engage in violence. They argued that these myths could distort risk assessments. But what we're really talking about in terms of myths is actual disableism and ableism that is there. So as I advised, like mentioned earlier on, we see the largest proportion of domestic homicide victims were people aged 70 and over. So, you know, are we detecting this enough? Are we doing more preventative work within the adult social care around this area? Are we doing enough education? These are just things that I'm just putting out there that we need to really carefully reflect on. In my experience and what I can see is in terms of, for example, financial abuse, people kind of take it outside the context of domestic abuse and just don't see it as a domestic abuse issue. But we get plenty of referrals regarding financial abuse. And I think that sometimes the categorization is not necessarily correct. So these are things that we need to consider. So now I'm going to focus on the literature in regards to barriers to support. So there is a lack of accessible refuges for disabled people. The DVA sector are not equipped to provide specialist support for people with physical disabilities, learning disabilities, just the education on how to work properly with people. Other barriers include lack of skills and knowledge from professionals. So Rob 2021 undertook a qualitative study utilising semi-structured interviews. She interviewed 15 social workers working in adult services team. She identified her findings suggest a gap in knowledge around risk management of cases. The social workers in the study expressed that they found domestic violence cases complex. Some of the complexities identified include difficulties with working with both the victim and perpetrator, which I can tell you is a complete bad practice. So if that is happening in your local authority, yeah, it's not going to be helpful for anybody to manage those types of cases. The study also found that social workers found it challenging to identify domestic violence and abuse within a familial context. So again, basically these barriers are a result of ableism and disableism. So the research evaluation aims were to develop an understanding of the adult social care response to disabled people subjected to domestic violence and abuse, establish if adult social care workers can identify domestic violence and abuse reasonably and assess the risk level, assess confidence levels, and to make recommendations for workforce standards. So to achieve the aims of the study applied a mixed methods approach to data collection and analysis. So a mixed method approach infuses quantitative and qualitative approaches to data collection and analysis of data findings. The approach basically allowed me to triangulate the research. Now, this is a very small study, small valuation. So in terms of generalizability, you would not be able to do that, but it's still useful in any case. I utilised an online survey, which included a schedule of survey questions consisting of multiple choice, open-ended questions, Likert scaling questions, and 3 vignettes, which are similar to case studies. An online survey and vignettes were deemed appropriate since all adult social care staff have access to laptops, and also vignettes, which are basically case studies, like I said, resemble real-life scenarios, as most social care workers will receive their referrals through the in-house database. So I used intersectionality as a critical lens when considering my overall research, particularly because it acknowledges the impact of intersecting identities such as disability, class, gender, sex, and race. So in terms of ethical consideration, obviously the online vignettes, the survey, were anonymous. And one of the reasons why I chose to use vignettes online, it was basically to reduce the feeling of shame, of not knowing the answers. Over the years, shame has played a significant role in social work, particularly in fatal child abuse cases. And yeah, I think that there needs to be a focus on how we do research professionals, and particularly adult social care and social work, and any professional, helping professionals. We need to be mindful and be sensitive to how we do that. So yeah, I thought about that. And of course, I gained ethical approval from the University of Northampton and gained consent from the principal social worker to undertake the study. So we'll go into the quantitative results. So an estimated amount of 35 adult social care workers were eligible to complete the survey. I received 12 responses. This response rate could be perceived as low. However, given the current pressures at present in terms of retention, recruitment, and we're not going to mention the C and the rest of it. So those types of things can have implications in terms of the pressures that people are undergoing. Also, the nature of the actual evaluation, cognitively, there were 3 case studies. So I was kind of asking for a lot, to be honest. So upon reflection. So as you can see, majority of participants were social workers. And the majority of participants were confident about talking to service users or people who access adult social care about domestic abuse. Participants were asked how confident they felt about their knowledge about different forms of abuse. So they felt most confident about physical abuse, economic abuse, sexual abuse, and coercive control. I was quite surprised that people felt fairly confident about coercive control, because I think it's actually quite a complex form of domestic abuse, and it's quite contextual. So I was, quite interested to see that was good confidence levels there. And again, psychological abuse, threatening behaviour, forced marriage, and online digital abuse were areas where they felt most confident. Participants were least confident about female genital mutilation. This is not surprising, since FGM is more prevalent among young girls between infancy and the age of 15. Therefore, adult social care staff are unlikely to be managing the initial FGM in those circumstances, and probably not receiving the type of training that perhaps maybe children's services may receive. This is not to say that we should not be receiving training around this area, and that we should not be aware that this can occur and how we can perhaps support people who've experienced that, but it might explain why there's less confidence in that area. Similarly, the data suggests low confidence levels and uncertainty around knowledge concerning so-called honour-based violence. And noticeably, there was more confidence concerning forced marriage, despite forced marriage being a form of honour-based violence. So these results kind of suggest a disconnect in the knowledge base underpinning forced marriage. So markedly, the domestic violence and abuse topics with the least confidence levels were also areas that predominantly impact racially minoritized groups. So I then looked into domestic violence and abuse and the knowledge of available services. So one participant was aware of the Sanctuary scheme, which is commissioned to keep victims of domestic abuse safe in their own homes. 4 participants out of 12 were aware of domestic violence services for men. 10 participants were unaware of domestic violence services for deaf victims. This does mirror the literature pertaining to deaf victims' experiences with professionals when accessing support. Overall, the findings suggest that more awareness raising around available services is required. So then we looked at the available services, knowledge, how to refer. Just bear with me a second. So this one's actually how to refer. Sorry, I've got the wrong heading for it. So 8 participants knew how to refer to Coventry Rape Crisis Centre, 8 participants knew where to get support from family law, and 0 participants knew how to refer to the Sanctuary scheme. 1 participant of 12 knew how to refer to men's services of domestic abuse. And considering the data around disabled men subjected to domestic abuse, this is really of key importance to know that. 1 participant knew how to refer deaf victims for support. I guess one thing that we all should be asking ourselves, if we are aware of the services in our local authorities, and if not, then maybe it's time to kind of get to know and see what's available out there. So I then looked into risk management tools and knowledge around that. So knowledge around the domestic abuse, stalking, harassment and honour-based violence assessment. So 10 people said that they've heard of the DASH tool, and 3 people have completed the DASH tool, and over 58% participants said they do not know how to use the DASH tool. So we're now going to go to qualitative and quantitative results. So there were 2 key themes from those results. Theme 1 was divergent views on information sharing, and theme 2 was divergent views on risk identification and analysis of risk. So if you want to take a few moments to look at that vignette, the case study. So the results from Greg's vignette indicate divergent views to risk identification and response to risk. For instance, 6 people believe Greg to be medium risk of domestic violence and abuse, and 5 people believed him to be high risk of domestic violence and abuse. Similarly, when participants were asked, they would inform the police that Greg is being subjected to domestic violence and abuse. Despite Greg stating, "I do not wish to report the abuse to the police," 7 answered yes, while 4 answered no. One participant didn't answer. So one likely reason for these differential responses may concern Greg's case being an example of coercive control, and the fact that Greg is a man. And coercive control is also quite complex and a subjective form of abuse. So these findings are not dissimilar to Langdon et al.'s 2023 Northern Lives and Times survey, looking into the public perception of coercive control. Their findings demonstrated that in less obvious cases of coercive control, where the victim was male, participants were less likely to believe they experienced domestic violence and abuse. Altogether, their findings indicated that male victims were perceived as lower risk. So here we've got the rationales provided for assessing Greg as medium risk. So there is no specific mention of coercive control in above rationales provided, although when I asked a separate question about the abuse type, the majority of participants listed coercive control. The results could suggest that in order for a victim to be deemed high risk, the individual must be in imminent danger. For instance, participant 1 states, this is a historic incident as it stands, so no immediate harm. Similarly, participant 2 states there's no immediate risk to life. Participant 5 also writes, not imminently life-threatening. It's almost as if participants require some form of physical harm for Greg to be considered high risk. These responses also suggest that coercive control is less harmful than any other forms of DVA. Controlling or coercive behaviour is a risk factor in domestic homicides and a significant precursor for domestic suicides. The answer suggests a disconnect between identifying the type of abuse and how this informs risk assessments. Vignette 2 highlighted divergent views regarding information sharing, and that really was the same case in Greg's case. So all participants agreed to make a referral to MARAC. Inconsistencies were found when participants were asked if they would report the sexual abuse to the police. 4 participants stated that they would not report the sexual abuse to the police. All participants said they most MARACs are led by the police. So this is why it's quite interesting. So most MARACs are led by the police. So therefore, a MARAC referral is a by proxy referral to the police. So these findings do suggest that participants didn't fully understand who attends MARAC. What's more, when a victim is assessed as high risk, it means that they're high risk of serious harm or homicide. So if you as a practitioner believe that they should be referred to MARAC, what you're saying is that they should be, you should really be reporting to the police. So that there's a little discrepancy there. So there are a few explanations that I kind of thought of, and I think one explanation as to why participants answered that they would not report domestic abuse to the police could be due to misunderstanding around choice and control. It's possible that participants are taking choice and control literally and not taking into consideration safeguarding and protection duties, data protection duties. So just to, I don't know if you can see it on the screen, but basically, mostly when you look through the diagram and follow it through, most of the time it's telling you to report, especially, you've got to be proportionate, to consider proportionality. But in cases, particularly high risk cases, it's suggesting that you should be reporting to the police. So also this kind of what I'm saying is really emphasised in the safeguarding and making safeguarding personal mythbuster. It reinforces the misconception that choice and control means that we do exactly what the person we are supporting wants. We obviously support people around decisions, but we need to prevent harm and homicide. So yeah, I think I do have a feeling that we need to kind of reacquaint ourselves with proportionality and whether we have conversations around our duties in terms of data protection. So overall findings of the evaluation indicate that there is an inconsistency in knowledge and practice, particularly around making decisions to contact the police or refer to MARAC, so essentially the information sharing. Information sharing has always been at the cornerstone of good safeguarding practice, and lack of information sharing has resulted in fatal consequences. We hear about it so much, so it's quite interesting to see that that's an issue. From an equality perspective, these inconsistencies around practice and knowledge may also suggest an inequality in service delivery and safety. So, from what I kind of could see is that, depending on what practitioner you might come across, you may get a referral to the police or MARAC, and that might, open up all types of support, whereas you might not get that. So yeah, it does highlight an inconsistency in practice. So the biggest tool that adult social care has to achieve a transformative understanding of risk are the victims themselves, victim survivors themselves. risk assessment tools, tacit knowledge, and research knowledge. So I had a lot of recommendations, as you can imagine, towards the end. I'll let you have a look at those, and actually it'd be good to hear if you have any recommendations, because this is basically coming towards the end. But yeah, so with immediate effect, practitioners need to be advised on the protocol around reporting domestic violence and abuse to the police. And where there is no protocol, the process should be developed. And where possible, practitioners must, in cases where they believe domestic violence is present, complete a domestic abuse, stalking, harassment and honour-based violence dash form. Practitioners are to receive specialist training and awareness around experiences of disabled people subjected to domestic violence and abuse. And I think it's particularly important that people are aware of the impairment-specific abuse and how this may look. And also, generally in safeguarding, we need to really think about the role of the rule of optimism and how that plays out. The local authority need to implement guidelines and strategies to manage and risk in DVA cases. Managers and practitioners to receive awareness training around available domestic violence and abuse services and how to refer. So due to the prevalence of domestic violence and abuse, the government should hold a consultation about the possibility of DVA screening of disabled people. Practitioners to receive specific training around male victims of domestic violence and abuse, especially when we look at that statistic, and really to apply an intersectional lens when working with victims of domestic violence and abuse. And practitioners to receive thorough training on domestic abuse typology and the associated risks. And of course, regular DASH training, although it's not necessarily fit for purpose, is what we have right now. And it does give an indication on this, on the risk level of risks too. So yeah, that's it. I do have some questions actually. I wrote these quickly, so please, you have to ignore any spelling mistakes. Apologies. But I thought it'd be good to have some reflective questions. Yeah, that's it, the end.